This is the today's MCQ, a 35-year-old man. So whenever a MCQ is given, you should read all the important clues in the question very carefully. So the age is also very important, and what medications the patient is on, that also is very important clue, which the examiner will try to mention in the question. So this patient was on cyclosporine since few months. Okay, since few months. Now he presented with 4 days history of fever. 4 days history of fever, cough and shortness of breath is there. 1 day prior to the above symptoms, that is before the appearance of fever, cough and shortness of breath, there was appearance of some skin rash. And what was the type of skin rash? Pruritic vesicular rash. Pruritic vesicular rash was present on face, trunk and limbs. And chest X-ray findings are mentioned, they were suggestive of pneumonia. So with all these clues, the examiner is asking the diagnosis of this, and if you have marked the answer as option B, disseminated varicella infection, absolutely correct answer. So why is this varicella infection, disseminated varicella infection, the answer here? Because usually you might have heard the varicella, that is chickenpox, which is caused by Varicella-Zoster virus. Varicella-Zoster virus, which is human herpes virus, it is caused by this HHV3. This is usually seen in the childhood, where the presentation is going to be discrete vesicular lesions over the body, mainly involved in the central portions of the body, that is the distribution is mainly centripetal and the spread is centrifugal. And the classical description of the lesions is dewdrop on rose petal appearance. You might have heard of all these things, okay, childhood with complaints of the this kind of a vesicular rash. But here the patient is a adult. So why we are getting into this diagnosis of varicella is because the important clue which is mentioned, that is cyclosporine, which is a calcineurin inhibitor, and it is basically a immunomodulator, or we can say it can also suppress the immunity in the individuals. Okay, because of this, what will happen, this HHV3, which usually presents in the childhood, it can be a complication of this immunosuppression in the adult, because of which the manifestations are going to be in the form of severe varicella infection, that is severe chickenpox in adults is the presentation, in which we can say, of course, this vesicular rash which you are able to see over the body, and it is almost involving entire body. And along with that, even patients can have the physical findings, that is the fever, malaise, the shortness of breath, and on chest X-ray they can have these features of pneumonia, which is classically described as varicella pneumonia, which will give starry sky appearance to the chest X-ray. If that were to be mentioned. So and some students have answered it as anaphylaxis to cyclosporine. Please remember, if it was anaphylaxis to cyclosporine, because of which these presentations were seen, it would be immediate. Okay, it would be immediate, but the patient is taking cyclosporine since few months, so it is not option D. It is not option D. And after option A, there would have been some mention of some features which were suggestive of tuberculosis. Like for example, there would be a mention of Mantoux test, or there would be a mention of AFB on sputum. So they are all not present. So it is not tuberculosis. And Kaposi sarcoma, it is going to present in the form of erythematous plaques, but not vesicular lesions as given in this case. So it is not Kaposi sarcoma. So you can even rule out the options and come to the diagnosis for this particular question, and try to guess what is the answer for this. Sarvam Shri Krishnarpam Sarve Jana Sukhino Bhavantu.